Tonight's bedtime lesson out of 2 is called Blisters. There we go. Blisters are small pockets of fluid that usually form in the upper layers of skin after it's been damaged. Blisters can develop anywhere on our body, but are most common on the hands and feet. Most blisters are filled with a clear fluid or serum. This cushions the tissue underneath. It protects the tissue from further damage and allows it to heal. Blisters may be filled with blood, or also known as blood blisters, or pus if they become inflamed or infected. What causes them? Blisters can be caused by friction to the skin, heat, for example from sunburn or a scald, contact with chemicals like detergent, and medical conditions like chickenpox and impetigo. Treating blisters. Most blisters heal naturally after 3 to 7 days and don't need medical attention. It's important to avoid bursting the blister. This could lead to an infection or slow down the healing process. As new skin grows underneath the blister, your body slowly reabsorbs the fluid in the blister. The skin on the top will dry and peel off. If the blister does burst, don't peel off the dead skin. Instead, allow the fluid inside of the blister to drain and cover the area with a dry, sterile dressing. This will protect it from infection until it heals. However, speak to your GP if you have blisters that you think are infected. An infected blister will be filled with yellow or green pus and may be painful, red and hot. Are very painful, keep coming back, are in unusual places like the eyelids or inside the mouth, appear from severe sunburns, burns, scalds, or an allergic reaction, and develop after you have come into contact with chemicals or other substances. Treatments for blisters. Antibiotics may be prescribed to treat an infected blister. If you have a large or painful blister, your GP may decide to decompress the blister under sterile conditions. If your blisters are caused by a medical condition, your GP will be able to tell you how to treat the underlying condition. Preventing them. There are a number of things you can do to avoid getting blisters caused by friction, sunburn, or chemicals. Blisters caused by a medical condition often can't be prevented and need to be treated by a GP. Here are the do's. Wear comfortable, well-fitting shoes. Use clean socks. Try moisture-absorbing socks. Change your socks twice a day if you have sweaty feet. Wear thicker socks or apply talcum powder to keep your feet dry. Choose comfortable shoes that fit properly. Stop and apply padding if you feel a hot area on your foot while walking, exercising or playing sport. Put on gloves when handling chemicals, using tools or doing gardening. Use sunscreen and keep your skin covered to avoid sunburn. Wear protective equipment when handling heat or chemicals. Wear protective gloves when handling detergents, cleaning products, solvents, and other chemicals. Time for our second bedtime lesson.